Welcome to the Lippincott Medical Surgical Nursing video series. Today's topic, caring for a patient who has had a cerebrovascular accident. In this module, you'll learn what's involved in caring for a patient of this type and how to deal with the special circumstances the patient presents. We'll begin with the report you received from the nurse who was last on duty. The summary report you'll hear today is in the SBAR method: situation, background, assessment, and recommendations. Here's an example of what may take place.
Oh, thank you.
Good morning, Cynthia.
Oh, hi, Ann.
Hi.
Are you the next nurse for Mr. Jordan?
Yes, I am.
Would you mind if I gave you the report now?
Sure, not at all.
Great. Okay, well, now here's the situation. You ready? The patient is Lamont Jordan. His doctor is Sandra Walton. Mr. Jordan is a 70-year-old male, and he's allergic to penicillin.
Okay.
Mr. Jordan was admitted with a CVA.
And by CVA, you mean cerebrovascular accident?
Yes.
Okay.
3 days ago, Mr. Jordan was found at home by a neighbor. He was lying on the floor, unable to move. The neighbor called 911, and the ambulance brought him to the ER. He was diagnosed with a middle cerebral artery stroke by CAT scan. Mr. Jordan was admitted to the ICU for 2 days, and then yesterday he was transferred from the ICU to us here on the general medical floor.
And what else did they find out about him in the ER?
Well, his physical assessment revealed expressive aphasia, right-sided hemiparesis, and right-sided homonymous hemianopsia. Now, the ER staff called Mr. Jordan's daughter. She lives 6 hours away. She reported that during her last 2 telephone conversations with her father, which had taken place over the last couple of days, he did seem confused.
Patients who have expressive aphasia often have difficulty forming words that are understandable,
It's okay. We'll try it a different way.
or they may only be able to speak in single-word responses. Hemiparesis is weakness of the face, arm, and leg of the same side. This weakness is due to a lesion in the opposite hemisphere of the brain. Homonymous hemianopsia is the loss of half of the visual field. For example, this shows a normal field of vision. And this is the field of vision for a patient with right-sided homonymous hemianopsia.
As far as the medical problems in his background, Mr. Jordan has a history of hypertension, hyperlipidemia, and diabetes mellitus. He had his gallbladder removed at age 50, and he smokes half a pack of cigarettes a day.
Is he currently taking any medications?
Yes, aspirin 81 milligrams daily, Lipitor 20 milligrams every evening, and lisinopril 10 milligrams daily.
Okay.
Now, he also gets heparin 5,000 units sub-Q BID, glipizide 10 milligrams PO BID, and regular insulin on a sliding scale with Accuchecks AC and HC. Mr. Jordan's fasting blood sugar this morning was 227, and he'll need 2 units of insulin prior to breakfast.
Okay.
Now for the systems assessment. Neurologically, Mr. Jordan is awake and alert to person, place, and time. He responds appropriately to yes and no questions. He doesn't have much problem saying yes or no, but he gets very frustrated if he has to say anything else, although occasionally he can.
Okay.
He has weakness on the right side of his body, which I would rate 3 out of 5. And he's missing the right side of his visual field. His pupils are equal and reactive to light, with his right eye being a little sluggish. Cardiovascular, his heart rate is regular, no adventitious sounds noted. Respiratory, his lungs are clear to auscultation.
Okay.
Gastrointestinal, the abdomen is soft and non-tender. He has positive bowel sounds in all 4 quadrants and had a bowel movement last night.
Good.
And he's on a soft diet with aspiration precautions. He can feed himself, but choking is definitely a risk. Now, genourinary, Mr. Jordan voids in the urinal without difficulty. And integumentary, his skin is clean, dry, and intact. We have been helping him to change his position frequently because he's at high risk for skin breakdown.
And what are your recommendations for his care today?
Well, today I think I'd recommend the following things. Because of his stroke, he's having trouble expressing his thoughts. So to make communication easier, try asking questions that can be answered with a yes and no, and give him some extra time to respond. Now, he might have a little trouble answering, but he's using words correctly. Most times he just nods or shakes his head. The right-sided homonymous hemianopsia means that he's lost his right field of vision in both eyes. So keep that in mind. Try to position yourself on his left side so he can see you.
I'll remember to do that.
Now, you're also going to want to assess Mr. Jordan's neurologic status, watching for any changes. There is a neurological flow sheet with the nursing notes. And you know that because of the weakness on the right side, you'll have to take special care to assess his skin integrity.
Okay.
Now, finally, we're trying to get Mr. Jordan up and out of bed when the opportunity presents itself, especially around meal times, because he's at risk for aspiration.
Okay, I will keep that in mind.
Great.
Well, thanks for the report. I think I have everything.
Well, you're welcome. Good luck.
You're about to watch a registered nurse perform a focused assessment and provide care to a patient who has experienced a cerebrovascular accident. Note how she performs each step, and just as important, how she explains what she's doing to help the patient understand what's being done and why.
Good morning, Mr. Jordan. I'm Ann. I'm going to be your nurse this morning. Can you see me okay?
No.
I didn't think so. Can you see me now?
Yeah.
Okay, good. I'm Ann Cooper, and I'm going to be your nurse. I'm just going to go wash my hands, and then we'll get started.
Dr. Statement, please. Michael Crawford.
So I just want to check your ID band.
Please call 340.
Can you tell me your name? It's okay. We'll try it a different way. Is your name Lamont Jordan?
Yes.
And is your date of birth December 2nd, 1939? Do you have an allergy to penicillin?
Yes.
Do you have any other allergies, Mr. Jordan? Okay, good. We're gonna get started with your vital signs. I'm gonna get your temperature. And open. Good. Okay. 98.5. That's good. Okay, and next I'm gonna take your blood pressure. I'm gonna put this blood pressure cuff on, and when I pump, it's gonna squeeze your arm a bit, okay? You can relax down. Are you ready?
Blue team to ICU, please. Blue team ICU.
Okay. It's 150/88. Now I'm going to measure your heart rate. So your heart rate is 72 and your respiratory rate is 20. That's good. And last but not least, let's see how much oxygen your blood is carrying. I'm just gonna put this on your finger. Okay. 96% on room air. That's just fine. Mr. Jordan, your vital signs are good this morning. That's good news.
The nurse completes a neurologic assessment on the patient, looking for any changes from the prior assessments. Changes in any of the findings could indicate either improvement of the patient's condition, or they could mean the patient is experiencing another cerebrovascular accident.
Now, Mr. Jordan, before they bring you your breakfast, there's a special assessment I want to perform. It's called a neurologic assessment. It allows me to assess and track how well you're recovering from your stroke. First, I'll start here. Do you know what month it is?
Yes.
And can you tell me? It's okay. I'll ask you questions that you can answer yes or no to. Is it December?
No.
Is it August?
Yeah. Yes.
And are you at home?
No.
Are you in the hospital?
Yeah.
Okay, that was great.
Even though the patient could not express specifics, the nurse was able to assess the patient's orientation to person, place, and time by rephrasing the questions. The nurse assessed the patient's orientation to person while checking his ID bracelet. As a nurse, you may have to alter how you assess a patient based on the patient's current condition.
Okay, I can see you're having a little trouble expressing what you want to say. And this may get easier with time. We'll work with you on that. As part of your rehabilitation, you'll be working with a speech pathologist, a healthcare professional who has experience helping people maintain or regain the ability to speak, swallow, or chew. I think the speech pathologist will be stopping by later to meet you today. Now I'm just going to ask you to follow a few simple directions. Can you smile for me? Good. Now can you show me your teeth? Yeah, good. Now, try and raise your eyebrows for me. That was good. And can you close your eyes shut for me? Tight. Good. That's great. I'm just gonna take a moment and jot some things down.
When the patient demonstrates the various actions, watch the patient's face, assessing for symmetry of the face.
Now to check your strength, I'm just gonna place both my hands on top of your arms, and I need you to lift your arms for me. Let me just adjust a bit.
When assessing the patient's strength, it's helpful to use a standard measure, such as a scale of 1 to 5.
Now I'm gonna ask you to lift your arm for me. Okay, good. I can see that your left arm is much stronger than your right arm. Let me just write that down. Now I'm gonna check the strength in your legs. First, let me close the door and then we'll pull the sheets back. Okay. Now what I'm gonna do is place my hand over each one of your thighs, and I just want you to bend at the knee. Okay? First your left leg. Good, nice and strong. Good. You can relax. And now your right. Okay, that's good, that's fine. Yes, I can tell that your left leg is significantly stronger than your right leg. Let me just write that down. You still have a bit of weakness on your right side, which is to be expected. As you heal and work with the physical therapist, you'll eventually regain some strength. It's important that you maintain a positive attitude and keep your spirits up.
Okay.
Now I'm just gonna cover your legs back up and take some notes. Okay, so now I need to check your gag reflex. I'm gonna use this tongue depressor to place toward the back of your throat. I apologize, it's gonna feel a little bit uncomfortable. Can you open? Can you say ah? Okay, that was good. I know that didn't feel good, but it shows that you have a gag reflex, which is a positive sign for chewing and swallowing. Are you looking forward to eating breakfast?
Yeah.
Good. Now we're gonna check how your pupils respond to light. I'm just gonna turn the lights off. Okay.
When assessing the pupils, darken the room. Then, using a pen light, approach each eye from the side.
So, Mr. Jordan, I'm gonna shine this pen light into each one of your eyes. All you have to do is look straight ahead and keep your eyes open. First, I'm gonna do the right eye.
When looking at the eye, assess each pupil for equality of size, shape, and its reaction to light.
I can see that both of your pupils are equal round and reactive, but the right pupil is a little bit slower than the left. I'm just gonna turn the lights back on. So your right pupil, sluggish, and your left pupil, well, it's brisk. Okay, Mr. Jordan, we're finished with your neurologic assessment.
When performing a cardiac assessment on a patient who has experienced a cerebral vascular accident, listen to the 5 areas of the heart, checking specifically for any irregular rhythms or abnormal heart sounds. Be sure to document the heart rate and rhythm and notify the doctor if any abnormal heart sounds or irregular rhythms are heard.
Okay, I'm just gonna take a quick listen to your heart. I'm gonna need to go under your gown, is that okay?
Yeah.
I'm just going to unfasten it. And now I'm gonna listen. Good. So your heart rate is regular, and there are no unusual sounds. I'm gonna have to take a listen to your lungs, but first I'm gonna sit the bed up.
When performing a respiratory assessment on a patient who has experienced a cerebral vascular accident, listen for any abnormal lung sounds.
So I'm gonna listen under your gown, is that okay? I'm just gonna need you to take some deep breaths for me through your mouth.
Any abnormal lung sounds could indicate a potential complication. If any abnormal sounds are auscultated, document and report your findings to the doctor.
Deep breath. And again. Now I need to listen from the back. I'm just gonna help you lean forward, okay? Good. Deep breath. And again. And again. And last one. I'm gonna help you. Good. Your lungs are nice and clear. Just what we want. Okay, Mr. Jordan, it's very important that I assess your skin frequently. The stroke may have affected your ability to feel pressure and pain on your right side. This can put you at risk for complications such as pressure ulcers. We'll be helping you to change your position frequently to prevent those complications. Right now, I just want to visually inspect your skin to make sure it's intact and healthy. I'm going to be looking at what's called pressure points, places where pressure ulcers are likely to form. I'm just going to take a look at your arms and your elbows. I'm just checking for redness in the area. I'll also need to check your lower back and your hips. So I'm going to lower the head of your bed. Okay. Almost there. Okay. I'm going to remove your sheet again so I can help you turn to your side.
To perform a skin assessment on the hips and lower body of a patient who has experienced a cerebrovascular accident, help the patient to roll onto the weaker side first.
Can you bend your left leg for me?
By rolling to this side, the patient can help out by using the muscles of his stronger side.
And then we're going to use the left arm to grab the side rail. I'll support you. Good.
Once the patient is in position, inspect the pressure points on the hip, sacrum, and both heels, looking for redness.
Okay, good. We're going to do the other side now. You can let go. And I'm just going to go around to the other side of the bed, and we'll do the opposite side. Now, I'll help you bend your right leg. And you're going to do the same thing. Good. All right, that's good. You can roll back. Good. And I'll cover you back up. Your skin checked out. I don't see any redness or any broken down areas. That's very good. You know, preventing skin breakdown and pressure ulcers is going to be a real big focus of your care while you're here in the hospital and at home. To help assist in this, a physical therapist will be working with you to help you regain as much strength and mobility as possible. You'll want to practice the techniques and exercises he teaches you because they'll help you gain the strength and skills you need to reposition yourself regularly. And that's really critical for preventing complications like pressure ulcers from developing. All right, Mr. Jordan, I've completed all of my assessments. Are you ready to get out of the bed and sit in the chair for breakfast? Good. Well, first, let me make sure the brake is on, and then I'm going to lower the bed.
To help the patient out of bed and to a chair, first put the bed in the lowest position. Make sure the brakes are locked and raise the head of the bed to 90 degrees.
And now I'm going to raise the head of your bed.
Be sure to ask the patient if he feels dizzy or lightheaded at this point.
I know that was quite an adjustment for you. Are you feeling dizzy at all?
No.
Okay, great. So next thing we're going to do is get your slippers on.
Next, assist the patient in putting on shoes or slippers. Make sure the footwear has a non-slippery sole.
You doing okay? So do you feel up to moving your legs to the side of the bed? Good.
Then, put the chair next to the bed on the patient's strong side. In this case, the left. Cover the chair with a sheet or blanket.
Are you ready to move your legs to the side of the bed? Okay.
Yes.
Let's try that. Okay. I'll get this one. Use the side rail.
Help the patient to sit on that side of the bed and again, ask if he feels dizzy or lightheaded.
Good. Are you feeling lightheaded or dizzy?
Yeah.
Okay, we can wait until you're ready.
If necessary, wait for any dizziness to subside and be sure to document at which position the dizziness occurs.
Are you saying you're ready to move to the chair?
Yeah.
Great. First, I'm just going to put this gown over you. You can use it as a robe.
When assisting a patient with a weak extremity, brace your front knee against the patient's weak extremity. This prevents the weak extremity from buckling and keeps the patient from falling.
Okay, now I'm going to help you get out of the bed. I'm going to support your weaker leg with my knees. And I'm going to also hold onto your waist. While I'm doing that, you're going to help push yourself off the bed with both of your hands on the bed. We're going to move on the count of 3. You ready? Okay. 1, 2, and 3. Good. Now we're going to pivot towards the chair.
Help the patient pivot to the chair on his strong leg and ask if he can feel the chair behind him. Then have the patient hold on to the chair with his strong arm and lower himself into the chair.
Can you feel the back of your legs up against the chair?
Yes.
Now I want you to reach for the arm of the chair. First with your left. Good look. And now with your right, I'll help you with that. And then we're going to ease into the chair. Good. Next, I'm going to get you your call bell. We want that to be close to you. How's here? Okay. I'm going to cover your legs with this sheet also. I'm sure you want your telephone and your remote close to you also. Almost there. I'll be back in 10 minutes with your insulin. Your breakfast should be here around 9. Okay?
You will return all of the equipment and promote good infection control practice by washing your hands. When compiling your report, keep in mind that by noting trends from one assessment to the next, you can provide helpful insights for the patient's care. Based on your assessments, the nursing diagnoses for this patient could include impaired physical mobility related to hemiparesis and loss of coordination, impaired verbal communication related to dysarthria, risk for impaired skin integrity, and disturbed sensory perception related to right-sided homonymous hemianopsia. Thanks for watching this video on caring for a patient who has had a cerebrovascular accident. Be sure to also study the instructions in your textbook, and please review this presentation at any time to support your learning and patient care.